Very beautiful story there. Now, 80 kilometers south of Nairobi lies a small busy center called Bissil in the heart of Kajiado County. The 2019 census estimates that 7,812 people live here. When COVID-19 struck, Kajiado County, having a border town and its proximity to Nairobi, was one of the high-risk counties. Simon Kadinga, a guard at one of the health facilities, recalls his fight with the virus 5 months ago.
80 kilometers south of Nairobi lies a small busy center called Bissil in the heart of Kajiado County. The 2019 census estimates that 7,812 people live here. When COVID-19 struck, Kajiado County, having a border town and its proximity to Nairobi, was one of the high-risk counties. Simon Kadinga, a guard at one of the health facilities, recalls his fight with the virus 5 months ago.
Wakati ingine nilikuja huko ikifanya kazi huko osi, watu nilikuja lazima apime watu safi wote. Ikaja kupimia sisi, ikapatikana mimi niko naye. Wakati hiyo mimi nimestuka kabisa. Mpaka watu ya hii boma yote tukalia. Ikalia. Ninaona kama siwezi rudi. Mimi nilipeleka Ngong. Mimi nilienda kwa siku 7. Lakini mimi sisikii mwili yangu chochote, sijasikia hata homa. Ikafika siku 7, ikarudisha nyumbani. Ikaambia enda ujitenge kidogo na watoto. Nilikuja kwa ile nyumba. Watoto kahamia ile ni ya bibi yangu na hii ni ya mama yangu.
This is where Simon lives together with his family and siblings, though in different Manyattas. In order to isolate and not risk his family getting exposed to the virus, he had to find a solution to isolate.
Kiitisha chakula kwa sababu watu wote kwa hii nyumba. Na mimi naishi huko peke yangu. Unaua kwa hii kiti. Ninaambia watoto wanilete, mama aniletee mimi chakula. Chakula tunalete kwa distance. Ninapatia mimi nachukua chakula yangu naenda kukula ndani ya nyumba yangu. Wakati ile siku saba ikipita nilipima mimi huko Ngong. Ya pili nilipima mimi hapa Bissil Elsanda.
Norki Ramat, Simon's wife, had to go for quarantine at Bissil Health Center together with 2 other children who were identified as close contacts of Simon.
We suffered a lot because my husband and I were in isolation and the children remained alone. It was devastating because no one was available to even feed the children. We were sidelined and even our own children feared us.
Apart from lacking the moral support that they needed most, they were stigmatized, despite his siblings being aware of how to take care of someone who has contracted the virus. It does not seem to matter.
Nioga tu nimekuwa kubwa kwa sababu watu wote sinaona hii ni Manyatta. Hakuna mwenye nataka kuharibia mimi kwa sababu mimi niko na mgonjwa.
For this particular family, vacating this Manyatta was just one of the solutions to ensure that the younger children are not infected by COVID-19. His wife, who trades at Bissil Center, says that things are slowly changing and people are coming back to work with them as well as interact. Here at the trade center, the men rely on the food that she and other women cook, which is mostly ugali, meat and milk to sustain them as they await trucks to load with sand. Health workers have been their support system, with some showing up occasionally at his homestead to check on the children and ascertain that they are not showing any symptoms of the virus. This homestead lies deep in Olepolos village, marked by poor roads and thickets. It will take one a long time before they can access the nearest health facility. However, this has not deterred the hopes of community health volunteers who rise to the occasion to educate these pastoralist communities of the pandemic.
Kazi kubwa tumefanya katika villages ni kuelimisha watu wetu ili waweke social distance na wawe na maji tip tap kwa manyumba zao na wawe clean na wakae vile inavyotakikana.
Not all is rosy. Some days could be hard.
Wanaogopa sisi, wanasema nyinyi mko nao sababu wale watu wagonjwa ndio nyinyi mko nao. So tumepata changamoto kubwa hata sisi kuogopwa.
Amref Health Africa has made tremendous contributions in fighting COVID-19 in the country through support from its partners here in Kajiado County. Creating awareness and providing access to the needed personal protective equipment has been a priority.
Initially, when COVID came, the first cases were reported in the urban centers. So the communities thought that these diseases are for the urbanites and not for the community population. And sometimes people have challenges in terms of hand washing. But we've been able to go to the community and demystify some of these issues, and the communities have been able to embrace given guidelines in terms of ensuring that they protect themselves against infections.
As cases of COVID-19 continue to rise in the country, health workers remain at risk, demanding necessary measures to be put in place to protect them.
Based on the trainings that we had, of course, we had a training of infection prevention control within the health facilities, the isolation facilities. We were able to set up isolation IPC committees within the isolation facilities and also train them.
Maasai traditions have been challenged. Usually at this time, families will be gathering around celebrating different rites of passage as well as preparing for the festivities. But this will be a holiday with a difference.
Mimi sahi kikuta mahali hakuna watu, tuseme watu 3, inakaa karibu ya mita moja, mimi siwezi karibia mtu.
Achieving home-based care has been a problem here in the country, but Simon's family has ensured that there is isolation, there is social distancing, and most important of all, there is washing of hands from the young to the old. Saad Hassan, KTN News, Kajiado County.